I did my project on osteoporosis, and what this is known to be is a silent disease due to people not knowing that they may have it until the bone breaks. And the bones get weak and thin because the body is breaking down faster than it can rebuild it. So on my poster, I want to start with the pathophysiology. Osteoclasts break down faster than the osteoblasts can rebuild it, which makes the bones fragile and prone to fracture, especially, in the hips, the wrists, and the spine. And I have a picture right here on what that may look like. This is normal, this is abnormal, and you tend to see the kyphosis, which is the hunchback. This disease is, like I said, silent, but it moves progressively. And 200 million worldwide have been affected by this disease. So it is more prone in females than males. Moving on to risk factors, some things that we can't change. We can't change our age, our gender, ethnicity, menopause, or hysterectomy. With some modifiable factors, being able to change your diet, smoking, your alcohol use, insufficient exercising. So with the signs and symptoms, due to the fact that they show up late, so like a height loss, the hunchback, fractures or minor falls, and sometimes is the first sign of a broken bone as well. Type of screening you can do for this disease is a DEXA scan. So you want to educate the patient on getting these done annually if they can, just so they know that it is something that's serious with this disease. So with some treatment, what kind of medication do you take for this? You will take some bisphosphonates, and it helps build the bone and slow resorption. And so how can this complicate somebody's life? It will complicate their life by them being in pain all the time, limited mobility, needing assistance, and it reduces their independence as well. So some preventions, you want to tell the patient to stay active, avoid smoking, eating well, keeping their house well lit, clutter-free, hallways cleared of cords and rugs. And you want to tell them to wear the non-slip socks. And just being careful when they are around their pets. So some patient education, you want them to take their medication properly, get enough calcium and vitamin D, schedule those bone scans, and keeping their home safe. That's really the main priority, is keeping their home safe, especially if they live alone. You want them to make sure their house is safe and working order. And that is about it. Thank you.